Welcome to the O Ozempic and Semaglutide podcast. Get ready to hear from best-selling healthcare author Dr. Josh Luke as he facilitates a discussion on healthy weight loss and living healthy. And now, here's your host, Dr. Josh Luke.
Hey, welcome back to the Ozempic and Semaglutide podcast. This is part 2 of my interview with USC-trained pharmacist, Dr. John Probst. Fight on. We're taping this during USC-UCLA week, and I think I grew up a Bruin fan and then started teaching at SC, and so my kids are like, Dad, you're wearing Trojan stuff. I said, son, when somebody's paying your salary, you cheer for them. So
absolutely,
we've both turned to the dark side. So welcome back, John.
Thanks, Josh.
We're going to talk now about side effects of the injections. And of course, the injections, semaglutide is the generic name. Think ibuprofen versus Advil being a brand of the semaglutides. Across the board, they're pretty similar. And so I'm just going to kick it over to Dr. Probst to say, can you share with us the side effects that people are seeing when they're taking these injections? And we'll just, and then we talk about how you can kind of treat those or manage them.
Absolutely. There's always a trade-off. Any medication you take, you always want to know what the upside is, but obviously it's the adverse effects that sometimes derail patients from compliance with the medication or continuation with the medication. And as far as the adverse effects or side effects of the GLP-1 agonist, specifically Ozempic, usually it's gastric upset or GI upset. So nausea. In severe cases, people do get sick and sometimes throw up, diarrhea, sometimes loose stool, which is, a cousin to diarrhea, obviously. The more serious side effects would be gastroparesis, to the point where not only does your stomach slow down, but it actually stops emptying, which is a problem. Gallbladder issues, pancreas issues, various enzyme imbalances like amylase and things like that. Some folks get all worried when their enzymes get out of whack. And obviously, I think some folks have these adverse effects to the point where they question whether or not the outcomes are the ends are worth the means. So that's a discussion that every patient has to have with their provider. Pharmacists as well can weigh in on that, but for the folks that are doing it primarily for weight loss, not for just type 2, blood sugar management, you've really got to ask yourself, is this worth it, basically?
So it sounds to me, and if you just listen to that 2 minutes of our show, you'd be like, whoa, I don't know if I want to do this. That's a lot. But realistically, John, because I know in part 1 of our show, you said, yeah, hey, I think these things are proven to be safe. They're certainly effective, and the cost is coming down. You're kind of what you call the holy grail, the 3 things that you look for in any drug. But so just listening to the last 2 minutes, folks, we want to educate ourselves, but we're not trying to scare anybody off, because I can speak
absolutely.
I can speak personally, and I think I'm going to summarize what I just heard you say, that most of what you described is what a doctor or a pharmacist is going to tell you to be conscious of anytime you're dieting or trying to be on a weight loss plan. And this show's about like long-term healthy living weight loss is why we're doing this. But from what I heard, nausea, constipation, and or diarrhea. And by the way, yes, I can attest to all of those things so far. It's sometimes one extreme, sometimes the other. And the other thing, I don't know if you said it just like this, like you said off air, but regurgitation. So are those kind of the 3?
Yes.
Which is your kids would call burping or belching. So
yes.
My kids would at least. So nausea, constipation, or diarrhea, and then the 3rd would be regurgitation or belching. So let's spend a little time on nausea, because I'll just, before I kick it to you, my wife has had a little bit worse nausea than I have on the diet, but that's normal. She gets that even when we're not on the injections. But I've gotten it very rarely early on in the morning, and it usually was telling me, hey, eat something, you're hungry. And I used to do a lot of intermittent fasting until noon. I don't do that on this diet because I want to put healthy food in my body and not forget about it. So I just actually would eat a little bit, and I haven't really had to deal with nausea other than that. So talk about nausea, the effects of it, and in the injections, and give us a little more detail there.
Absolutely. And a quick disclaimer. side effects may or may not occur. So those are things that
Sure.
are in your package insert.
Yeah, I've had very
That's when the
little.
lawyers and the regulatory folks get together and put their package insert together to satisfy the FDA. But everyone's experience is unique and different. But as far as those primary side effects that you mentioned or adverse effects, gas, as I like to call burping, I forget the medical term for burping. It's a funny one, but yeah, no, that one coupled with acid reflux, let's say, that one's readily treatable. As far as your motility, constipation or diarrhea, there are interventions for those as well.
Yeah.
The gastroparesis, I think we touched on that as a less of an issue, but ultimately, if you do have those adverse effects, you can always share them with your physician, and there are treatments that you can use to mitigate those. Your PPIs, your proton pump inhibitors, or your H2 blockers, those are meds that are some OTC, some prescription. Think of like Protonix or Prevacid or Zantac, things that would help kind of keep the acid under control in your stomach. As far as burping, good old-fashioned simethicone. So Gas-X, that's one that I think every household probably has.
Yeah.
And then as far as constipation or diarrhea constipation, I think of usually from a preventive standpoint, you can think fiber, but usually a little bit of Miralax would go a long way, or some Docusate, which is Colace, that's a stool softener. Also encourages you to drink a little more water throughout the day. Water intake is actually a critical element to managing some of these side effects. And diarrhea, you usually can, if it's not severe and prolonged, you can usually get away with a little bit of Imodium or some Lomotil. If it does get a little serious, Lomotil is prescription only. But yeah, managing those side effects, at least when you onboard the medication, that is critical to your success, because we don't want people starting it and then having a negative experience to the point where they would discontinue treatment.
Is it safe to say, when we talk about side effects, to put them in perspective, that if you've ever experienced these things before, there's a likelihood you may experience them at the same level, or maybe a little bit more aggressive early on, because your body's reacting? Because I would describe that's how it's been with my wife and I on our journey. It hasn't been any worse than just when she's having a bout of this or that, or I am having a list. So is that fair to say, so we're not scaring people, that it's just kind of the normal stuff you'd experience, but you might experience a little more often on the injections?
Yeah, absolutely. And I do think there is a psychosomatic element to it as well. So you're starting a medication and you're thinking, gosh, these side effects I just read off, I'm going to have these. I'm probably going to experience them. So there's almost a precursor expectation built in that I'm going to experience this. And if you already have issues with those types of side effects or types of problems, then they may get exacerbated when you have a medication like a GLP-1 agonist on board. But as long as you've got someone reassuring you that they're manageable and transitory, I think that's a lot of times. I think people forget that some of these minor side effects tend to crop up once you initiate treatment, and they may lessen or disappear over time.
And folks, we're taping this in, fourth quarter 2023. You cannot access these injectable medications without a physician's involvement. And I would recommend that you don't, and that you talk to your doctor in advance, or a doctor like I have. The clinic I went to, we go to a clinic in Brea, California. They have another one in Whittier, the same company, and another one, I think it's in Mesa or Scottsdale, but they have a nurse practitioner. She spent a few minutes with me. Utilize those resources to ask these questions, particularly if you have health history, health risk, health concerns. Your doctor needs to be involved in this. I'm blessed to have a direct primary care physician. And for those of you that don't know, that just means almost like concierge medicine, where my family and I pay X amount of dollars a month, and we can text him and go see him anytime. So he's been very involved in this discussion with me for a couple of years, actually, because I started reading about Ozempic in 2021, asked my doctor about it, and he said, it's $500 a shot. It's once a week. It's still pretty early. But then by early 2023, he said, yeah, it's working. There doesn't seem to be a whole lot of downside, and the price is coming down. And that's when my wife and I started looking into doing it. So So involve your doctor, involve your pharmacist when you go to pick up medication, guys. I mean, that's what Dr. Probst is here doing, sharing some suggestions and strategies with you. So you said something that I want to hit on. I get asked about this all the time. This is why I created this show. I try to tackle new trends in healthcare, and this is the new trend, and I think it is going to be a long-term revolutionary thing for Americans because we're obese, and there's now a scientific way to lose weight if you show some discipline. It's these injectables. But what I was going to say is the people I know that tried it and it didn't work, what I hear consistently is they knew right away because they got sick or they didn't feel good or it made them feel awkward. So it wasn't even a week they were on it and they said, I'm out. I have not heard anybody who after 2 or 3 or 4 weeks just said, oh, it wasn't working or I quit. Because what I'm hearing is, right away. And I have my best friend, that's what happened with him. 3 days in, he's like, I'm out. It just made me feel awkward. I've heard that from other people. So what have you heard about that? Is that about the same thing you've heard?
I think those patients that are immediately turned off by their experience or don't have the results, I don't know, again, expectations in life tend to set us up for disappointment if they're unrealistic. But I do know some folks, sort of like pain tolerance. I think some folks have a medication tolerance, which can vary. Some folks are more accustomed to being put in a situation with the medication that they know is going to help them, that doesn't make them feel their best right away. And I think one area of medications that I definitely spend a lot of time in professionally would be psychotropics. I mean, there's lots of medications that we take to help with brain chemistry that 4 to 6 months really would be kind of your trial run before you know if it's working or not. So, but I advocate for that with these medications, not necessarily. But I mean, yourself better than anybody. And if you have a continuum of care with a provider that's known you for a while as well, and they know how you respond typically to medications, whether you have a medication tolerance, which is better than most. I never advocate for someone to tough it out, but they should go into it with expectations that it may not be all roses and rainbows. Sure. So there could be, again, a bit of a acclimation period to the medication that's a little rocky.
And dieting is hard. And my wife and I had to talk about this when we first started, like, hey, like we have to be on a meal plan and count our calories and use the app. And we want long-term healthy lifestyle weight loss where we can take it off and maintain it. And so it is hard, but the hardest part is that you're hungry, and this is solving that. So as long as you have a plan and you can stick to it. And look, people say, can I have a cheat day? Can I have a cheat meal? I have a cheat bite or two if there's food on the table in front of me that looks good and I want to try it. And that's been my favorite part about this diet. I've never been on a diet where I was able to have a bite of mac and cheese or a couple bites of au gratin potatoes that happen to be on my kid's plate or something, because it's just calorie intake and I'm counting it. It's not going to kill me. It's not what I want to eat a bunch of because it's not the right healthy foods and protein. But that's really what I like about this is I can see myself eating this way long term, whether or not I'm on the injection. So I really appreciate you sharing that. So folks, we're going to wrap up as we always do, asking Dr. Probst to share with us one of his favorite healthy snacks. But before we do that, to summarize, the 3 main side effects that seem to come up in almost every conversation, nausea, constipation, or diarrhea. It's somewhere, it's both ends of the spectrum, and the third one being regurgitation or belching. I've had mild cases of all of it. Most people I've talked to have had one or the other, some, and it's nothing that's going to make you go, oh my gosh, this is awful. I can't handle it in my case. So thanks for sharing those 3 things. Dr. Probst listed some others early on, and I have a really exciting announcement. Dr. Probst has agreed to stay on with me and do a quick bonus show with you, and he's going to help us discover once and for all, is Ozempic face a real thing? Because we've heard celebrities use that term. We've seen it on the internet. We're going to talk about, is it real and why? That's going to be a bonus show. So check it out. Look for that show. Please give us a like, share this with your friends, share it on your social. Let's get the word out about this weight loss revolution. Thanks to Dr. John Probst, clinical pharmacist, for just sharing his knowledge with us. Thanks again, John.
Absolutely, Josh. And I'm going to throw in that healthy snack really quick before
Yeah,
we
do
forget.
that.
Well, yesterday was Tuesday, and of course it's Tuesday tacos. So I'm a big fan of turkey meat tacos, little gluten-free Spanish rice. I've got a couple celiac children, so a lot of gluten-free items in our house.
Right.
Throw some seasonal veggies. I like squash,
Yeah.
and you're all set. Yeah, I can't beat turkey tacos.
Who doesn't like tacos, man? I mean, that's a whole different show, right? Like, who doesn't like tacos? And
Just go easy on the
lettuce
sour
tacos
cream. Yeah,
too.
that's all.
Yeah, I love to do lettuce tacos. You can get some pretty like lower carb and calorie tortillas now. So man, being in SoCal, we can't live without our tacos. So good suggestion.
Amen.
I like the ground turkey. We do that around here too. So thanks again. Don't forget, guys, check out our bonus show. Is Ozempic Face a Real Thing? Thanks again, Dr. Probst.
Hey, thank you, Josh.
You've been listening to the O Ozempic and Semaglutide podcast. Dr. Josh Luke is a PhD, but not a medical doctor, and none of his comments or comments of his guests are intended to be medical advice. Make sure to like, follow, share, and subscribe to the podcast on Spotify, Apple Podcasts, YouTube, or wherever you listen to podcasts. Thanks so much for listening, and we'll be back soon with a new episode.